Nicola Hill. The ethics of this must be quite frightening. I don't know what the committee is going to discuss, but what do you think they're going to be looking at in particular, and how can they give the okay to a human being being infected with a virus that can lead to death?
Yeah, it's quite an interesting one, isn't it? But you might not be too surprised to learn this has been done before. So Imperial College, which is one of the groups of the partnership, have been running human challenge trials for quite some time. In 2009, they did one on the flu pandemic, which happened here. And of course, influenza is a killer. You know, it is a coronavirus of its own. And they do this, they have these cold and flu units, and that's why they're keen to set up this first human challenge trial for COVID-19. Interesting response from various ethicists. A couple have spoken publicly today from Oxford University, and they actually say it will be unethical to not do trials of this sort, mainly because the people who are likely to be the volunteers, aged between 18 and 30, the chances of them being seriously impacted by COVID-19, they say, are the same as being killed in a car accident. And the organisation One Day Sooner, who we've discussed in the past, who have more than 38,000 people who've signed up worldwide to be volunteers, they say that it's the same risks as being a live kidney donor. So Imperial College are planning a two-step approach. So in January, with a small group of people who will be kept together in a clinical unit for at least 2.5 weeks, first of all, they're just going to be infected with the virus through their nose, because the scientists want to work out what's the lowest amount of virus that actually infects a person. And that's the first thing, and it's all part of safety. These people will be monitored, they will be checked, they are human guinea pigs. So they're going to be monitored for their health beforehand, and the only ones who can go in are going to be a small group, as I said, 18 to 30, no underlying health conditions, no obesity, no diabetes. And then once they're infected with the virus, they're going to monitor to see how easily the virus replicates, and they said that the intention is not to make them sick. This is Professor Peter Openshaw, who's leading it. He says the intention is not to make them sick, but just to monitor to see this amount of virus. I mean, I find that quite interesting, because surely they're going to get sick. What will then happen is that this group of volunteers will then have to have 2 negative coronavirus tests afterwards before they're allowed to leave.
Okay, Nicola, it's quite clear from your answer there that there's so much to learn. I mean, just the amount that it might take to infect somebody with COVID-19, because we have talked regularly about some scientists saying that actually if you touch a surface and then touch your eye or your mouth or your nose, there may not be enough SARS-CoV-2 virus on your finger to infect you. So this study will prove that definitively, I presume. What is the timeline here? From start to finish, if it starts in January, when would it end?
The end, I don't know, can't answer that one, but I spoke to a spokesman from Imperial College this morning who said that January they'll start, provided they get this ethical approval, they'll start with this, finding out how much virus is necessary to infect. And then probably about May, that's when they hopefully will be able to start introducing various vaccines. They haven't said which vaccines that they'll use. Professor Openshaw said maybe a head-to-head, they'll try a variety of different vaccines. And also antiviral drugs. It's not just the vaccines they're looking for, but better treatment options as well. So that's when they'll probably start doing that. Now, it was interesting that Professor Openshaw said that probably the vaccines that are around at the moment, those that you mentioned are in the phase 3 trials, might not be the vaccines that we'll use in 5, 7, 10 years. Presumably they expect to finesse the vaccines. But of course, the main aim of this is to speed things up, because we have got these 10, 11 phase 3 trials going on globally, large trials with lots of people. But of course, you can't determine when they're going to come into contact with the virus. Whereas in these human challenge trials, if you are going to give somebody the vaccine in May and then deliberately expose them to the virus, you'll see straight away whether any vaccine or treatment is effective. And that's why they reckon it will accelerate the whole availability of knowing whether a vaccine is effective or not. But then we've got to take into account that, you know, once we've found a vaccine that works, you've got to work, deliver it. You've got to give it to the people. And the other drawback with these trials is these are 18 to 30-year-olds. These are healthy people. Does that mean that those vaccines are going to work on people who are older or do have underlying health conditions? So Professor Openshaw says that's something that's going to be in the future. I can't tell you exactly when that's going to be, I'm afraid.
Sure, absolutely. Science isn't always completely exact. Nicola Hill, thank you so much indeed.